Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Risk assessment. Risk assessment is by an American Society of Anesthesia Grading. American Society of Anesthesia has given 6 grades for risk assessment. American Society of Anesthesia grade 1. In grade 1, normal patient. In grade 2, the patient has mild disease but no functional limitation. That is, for example, the patient has hypertension but the hypertension is under control on medication. In grade 3, there is severe disease with functional limitation. For example, the patient has malignant hypertension. It is severe disease and there is functional limitation. The type 4. In grade 4, there is incapacitating severe disease which is a constant threat to life. Here the patient has incapacitated severe disease which is a constant threat to life, like renal failure, like that. In grade 5, the patient is moribund. That is, surgery is the only thing that is available for this patient. In grade 6, the patient is brain dead. That is, here the surgery is done mainly for organ donations. ASA assessment, American Society of Anesthesia grades: grade 1 normal, grade 2 there is mild disease with no functional limitation, grade 3 there is moderate disease with functional limitation, grade 4 there is severe disease, incapacitating severe disease which is a constant threat for life, grade 5 which is the patient is moribund, grade 6 the patient is brain dead and we do organ donation. For organ donation we do the surgery, and E is added in emergency cases.
thank you and thank you for watching.